I'm Zach. I'm going to be your student physical therapist today. How are you doing?
I'm good. How are you?
Good. And what's your name again?
Michaela.
Oh, nice to meet you, Michaela.
Nice to meet you too.
So today we're gonna go through a few things. I hear that you're having some problem with your balance and you're feeling a little dizzy. So what I'm gonna do here is I'm just gonna do a few tests to see how you're doing and get some of your past medical history. And the whole thing should maybe take maybe 20 minutes. It's not gonna be too long right now. We just want to make sure that you're good to treat today. Okay.
Okay, sounds good.
So tell me more about your dizziness. Like how would you describe it? I know you said you were feeling dizzy.
Sorry, got distracted. So yeah, I feel like I have vertigo. Like I just feel like I'm spinning, or when I turn my head too fast, I just get really dizzy.
Okay. And so you did say you felt like the world is spinning.
Yeah, it just feels like everything is spinning around me.
Okay, that's good. And how long have you been experiencing the spinning feeling and dizziness?
It's been 3 days, and a friend of mine said that you were the best student physical therapist
Oh,
that I
really?
could come to. Yeah.
Well,
They said that you really knew what you were doing.
Well, I guess you have good friends then. Yeah, I'm going to try my best here to figure out what you have and try to treat this.
Okay.
So I'm just going to ask you some questions just so I can kind of rule in or rule out some different things. So have you ever had a blow to the head recently or in the past?
No.
Okay. So are you currently taking any medications?
Yeah, so I'm taking some for my hypertension, and then my doctor gave me, I think it's called Valium for my spinning. When I told him about it, he was like, oh, just take some Valium and that'll help with it.
Okay, and have you taken any today, any Valium?
No, you know what? I forgot.
Okay, so the Valium, it's really good to help the spinning, right?
Mm-hmm.
But when we're in therapy, we actually want to reintroduce those symptoms.
Okay.
So we basically have to trick our brain. We have to teach it that there's a problem so it can come up with a solution.
Oh,
so
that's
it's
interesting.
good that you didn't take the Valium today because we're going to work on stuff and hopefully we can improve your symptoms.
Okay, awesome.
So can you just give me a few goals that you have for therapy?
Yeah, I want to be able to go to the store without symptoms and be able to play pickleball again.
Oh, pickleball. I love pickleball. That's
I
so
know,
fun.
it's so fun. I just really got into it. My friends were playing, actually the friend that told me about you,
Oh,
we
really?
were playing pickleball together.
Oh, man.
Well, it's pretty hard to play when you're feeling dizzy, so we haven't in a while. But
So do you notice that one side bothers you more than the other? That you experience symptoms more if you're going one way or the other?
I feel like I notice it the most when I'm spinning to my left.
Okay.
It just seems like for some reason that position just it gets to me.
So I'm just gonna do some tests coming up, and I'm just gonna assume it's gonna be on your left side. So I might put you in a position facing towards your right.
Okay.
But that's just so I can rule out the other side.
Okay, sounds good.
Okay. And so before we do anything here, I think I got enough of a history that you'd be able to be treated today. I'm just gonna check some things first. I'm first gonna take blood pressure because I know you said you take hypertensive medication.
Yes, I know. Sometimes I just really like my sweets, so.
And that's common as we age. It's no problem. So if you can just put your arms resting on the table, and I'm gonna put this fancy cuff onto your arm.
Okay.
I know it's.
I've had this done a million times.
Oh, really?
So
So it shouldn't be too different. It's the same procedure.
Yeah.
We just want to make sure that you're healthy and in a good range to be treated today, okay?
Sometimes I think they just put me on the hypertension medications because I get really nervous when I go to the doctors.
Oh, really? You have the white coat syndrome they call it.
Yes, I do.
Oh, sorry.
No, that's okay. But then they just assume that I'm not healthy, which I might not be, but they don't have to know that.
Alrighty here. I'm just gonna have it nice and quiet.
Okay.
I'm just gonna pump you up here. Well, it looks like that medication is working because you're at 120/70. That's great. That's perfect numbers. So
Awesome.
that means we can treat you today. That's great.
Yes, that is great. I need to get this spinning out.
I'm sorry.
No, my watch gets stuck on everything, but I can't take the darn thing off.
Alrighty. So I'm just gonna check a few things before we get started. I just want to make sure you have enough motion in your neck. So I'm just gonna ask you to, can you bend forward for me and look down?
Yep.
Good. And then can you go up?
Yep.
And then just let me know if any of these motions give you symptoms, okay? And then can you touch your ear to your shoulder? And then touch your other ear to your shoulder? And can you look over here to the wall? Good. And then look over here to the steps? Good.
I went a little too fast on that
Oh,
one.
a little too fast. Okay.
Yes.
That makes sense. That makes sense
Okay, then.
based off what you're telling me.
Yes.
Okay, and then there's one more thing before I do some hands-on stuff with you. It's basically a position of your head that cuts off blood flow to the brain. So you could basically, if you cut off blood flow, you can get a little like lightheaded, dizzy. So we want to make sure that's not it. So can I ask you to put your hands on your elbow, cross your hands, put your elbows on your knees, and can I just have you look up, like you're looking up to the ceiling? And you just want to hold this for 10 seconds. And you let me know if you feel any of that same thing that brought you in today, any of that spinning or dizziness. I'm gonna hold this for like 10 seconds. Okay, and can you look up into your left?
Well, I looked to
Or
my
right?
right, sorry.
No, you're fine.
I'm bad with my directions.
Oh, it's okay. Any symptoms with this one?
No.
All right, and then you can look up towards the steps. Any problems with that? Any of those same symptoms that brought you in?
No.
Okay, that's great. So that makes me think that it's not like a vascular issue or
Okay.
like something with your blood flow.
Well, that's great.
So your
That's
blood,
very
your brain's getting enough blood, okay?
Okay.
Which is really good.
Perfect, that's all that I need. I just need to make sure that I'm getting old, but I don't want to be that old.
Oh, you're a jokester too. So what we're gonna do here is I'm just gonna run a few tests. I think it's something, but I'm gonna try all the other stuff first to make sure it's not that. I don't want to get you all your spinning to come back in the beginning, okay?
Okay.
So what I'm first gonna have you do is I'm gonna have you come up here on the table. And I'm just gonna have you lay on your back, okay?
Okay.
All right.
You want me on my back?
Yes.
No.
Okay. And then I'm going to actually just take this pillow away, if that's okay with you.
Shock me.
Okay, so basically what I'm going to be testing here is your vestibular system, which basically is a fancy system that coordinates eye and head movement, okay? So typically when you turn your head to the left, your eyes turn to the right.
Okay.
So what I'm doing with this test, I'm going to test certain canals. So first I'm going to have you just lay on your back, and I'm going to have you look towards the wall. And I'm going to be watching your eyes for any bouncing or nystagmus, they call it. And your eyes will tell me which canal or part of your brain that the problem is at.
Okay.
So just let me know if you feel any symptoms here.
No. I'm fine.
Okay, good. And then can we have you look over to this side? Any symptoms here?
No.
Okay, great. You're like the model patient. Alrighty. And we can have a seat set up. Perfect. We can swing it over. Alrighty. So you said it was on your left side, so the first thing I'm gonna do is actually test your right side.
Okay.
So the first time we tested the canals that look like this, and now we're gonna start testing the canals that look like this.
Oh.
And you can really imagine it like the Mickey Mouse hat. You know, you go to Disney World and everyone's wearing those hats with
Yes.
those ears. That's basically how it is in your head, but they're kind of off tilt a little bit.
Oh, interesting. Okay.
All right, so the first one I'm gonna do hopefully won't induce symptoms, but if it does, that's okay.
Okay.
But the second one is really gonna alert you. It's gonna get you all spinning again, which is actually a good sign, okay?
Okay.
So I'm gonna have you swing your legs up. And I'm gonna, oh, sorry.
That's my fault.
I'm just gonna have you turn your head to the right. I'm just gonna, okay, you ready? Like that. Any symptoms with this?
No.
Good, I'm just gonna wait a little bit. I don't observe any of that quick eye movement or nystagmus that I said before.
Good.
And I'm I'm gonna have you come back up. All right, now this is the one that I really think is gonna be the one. Okay, so we'll get through this together.
Okay, sounds good.
So I'm gonna have you look up and to the left. I'm gonna bring you back nice and slow, okay? Good. Good. Well, I notice some upbeating towards the left, nystagmus. Any symptoms with this?
Yes, they're awful right now.
Really bad.
They're the worst they've ever been.
Oh no, I'm so sorry.
This position is awful.
I'm sorry, but what we're doing here, we're trying to make you better, so it'll be worth it, I promise you, okay? So just let me know when those symptoms subside.
Yeah, they're gone.
Whoa, it's like I can see the future.
Yeah, how did you know that was gonna happen?
Hey, they don't call me the best physical therapy student around, okay?
No, they don't.
So
Not for nothing.
So what I'm gonna do now, since I think I know exactly what the problem is, I'm gonna treat it right away.
Okay.
We're gonna get you in and out today.
Okay.
So I'm gonna do this fancy maneuver called the Epley maneuver. So I'm basically gonna just move those crystals in your head to the right location so you don't get symptoms anymore, okay? So I'm just gonna rotate your head to the side. Good. And you let me know when the symptoms stop again, okay?
They're here
Okay.
and they're gone.
Okay, now I'm just gonna wait 10 more seconds, okay?
Okay.
Alrighty. And then I'm gonna actually have you keep your head in the same position, but I want to roll you on from, bring this shoulder up and keep this elbow on the table.
Okay.
Okay? Keep your head tucked. Good. Symptoms with this?
Yes.
Okay? And then let me know when they go away.
They're gone.
Okay, I'm just gonna wait 10 more seconds to ensure that all the crystals get in the right spot, okay? Alrighty, now I'm gonna have you sit up with the chin tucked in the right position. Just like that, don't move. Perfect. How are you feeling now? This might be the worst.
Awful.
Yeah, this might be the worst symptoms you had. But this is because all the crystals are dumping right into the right spot, okay?
Mm-hmm.
Have they gone away?
They're gone now, yeah.
Okay. I'm just gonna wait just a little bit more. And I'm gonna have you look up. Okay. So right now you might feel like you just went through a twister, okay?
Yes, I feel like I was on like, what's that spinny roller coaster?
I don't know.
It's not even a roller coaster, it's the
ride.
Gravitron.
Oh,
I
the
went on
ride.
that with my grandkids. That's
Oh.
probably why this occurred.
Okay, so that's good actually. That's what we want to see. Hopefully the symptoms will subside. What we want to do here is we want to have you call me back if these symptoms get worse or if they come back. Because the goal is that I got it all correct on the first try, but you may have to come in for another session like next week or in a couple days. But yeah, so we'll reassess in the future. And do you have any questions for me?
No, I don't think so.
We're just gonna have you hang out here for like 10 more minutes. I know this was really quick today, but I just wanna make sure you're in good shape to go home, okay?
Okay, sounds good.
All right, thank you so much.
Thank
I really
you.
enjoyed working with you
Yes,
today.
you too. You really are the best.
Hey, what's going on, Michaela? It's nice to see you again.
It's nice to see you too.
So I hear you're dizzy again?
Yeah, a little bit. I just feel so unstable.
Oh, really?
Like I can't go to a grocery store by myself without feeling these dizziness symptoms.
But it's not that spinning again, or?
No, it's not the spinning. It's like.
So that worked. That worked.
Yeah, that worked. That was like a miracle because I was able to do everything that I wanted to before.
Sure.
But now it's just like, I don't know. I feel weird. Like I can't be in a busy environment or I just start to feel that dizzy.
Well, thank you for letting me know about that. I'm gonna do some more examinations on you today. Not any of that positioning stuff because you said the world's not really spinning for you anymore. You feel like it's different. But first, before I get started, I'm gonna give you this symptom analog scale.
Okay.
It's basically a way for me to visualize how bad your symptoms are in your eyes. Okay.
Okay.
So on this end of the spectrum, no symptoms. You feel fine, normal. And on this side, it's the worst symptoms you can ever imagine. So when you are having those feelings that you're gonna fall and stuff, can you just mark here with the pencil where that would be on this line?
I think it would be, like, could I do it on like a scale of like 0 to 10? Like, if
Yeah, you can consider this to be 0 and this to be 10. And
so I would say, like, it never gets to like the point where I'm like vomiting or need to go anywhere. So I would say like there, because I feel nauseous.
Sure.
But I never, so like maybe like a 5 or stuff.
Sure, that's fine.
Okay.
So that's a good number for us to refer back to as we're doing some treatment today.
Okay.
Because like I said last time, we kind of want to get our brain to get those symptoms, but we don't really want to go too far above that.
Yeah. Okay.
We want to definitely excite it.
Okay.
So that we can help heal it. Remember, like I said last time, so this is something I'm definitely going to refer to back after I do some examinations on you. I'm going to put you in different positions, and I'm just going to quick refer, and then you tell me.
Okay.
So, going on here, so first, now I'm going to do what's called an ocular motor exam. So basically, it's just going to test how well your eyes and vestibular system work together, okay? So what I'm going to have you do here first is I'm just going to have you look at my nose, and I'm just going to bring you down a little bit of 30 degrees of flexion at Reed's line, and I'm just going to have you focus on my nose here, okay? I'm just looking for any what they call spontaneous nystagmus, which I do not see, which is good.
Okay.
Alrighty, and relax. The next thing I'm going to do here with my fancy pen, I want you to follow the pen tip with just your eyes, okay?
Okay.
No head movement, just all your eyes. I just want you to focus all on that, okay? So we're going to go this way. Holding at the end. I don't see any end gaze nystagmus there. Nice, smooth pursuits. That's good. I'm gonna hold it here at the right. Oh, I see a little bit of nystagmus on the right. Okay. And now I'm gonna just have you follow the pen. You tell me, I'm gonna bring it closer to you, and you tell me when you start to see double, okay? Double? Okay, that looks about right. Okay, now I'm gonna get with my other pencil here. I'm going to have you look with just your eyes as quick as you can at both tops.
Okay.
So I just want you no head movement, but just looking with your eyes, okay? That's really good. I don't see anything abnormal here. And then I'm gonna have it go vertical too. So I want you to look up and down, sorry. Any issues with any of this? Okay, good. That looks normal. Okay, now I'm gonna get hands-on again with you. So I'm gonna bring your head back down to that Reed's line that I said before. I'm just gonna push you back and forth. I just want you to keep your eyes on my nose, okay? Just focus on my nose. I'm gonna give you a quick little thrust, and I don't want you to slip off my nose. Okay, you ready? You're pretty good on that side. Oh, do it again. Good. Let's see this side. Oh, I saw a little slip there. Oh yeah, I did see a little slip there. Okay, so looks like you're a little bit weaker on that left side, which correlates with that right end gaze nystagmus. One last thing I'm going to do here. I'm going to bring you down. I want you to just follow your eyes on my nose, okay? And I'm going to move your head. Okay? I don't see anything abnormal here. Good. You're doing a great job, Michaela. All right, and one last thing that I would do if I had the materials with me, I would do the head shaking test. So I'd put on those goggles that block all the light. Now I'd have you close your eyes and shake your head 20 times pretty fast, and then I'd have you open up your eyes. And what I would see in your case, I'm assuming, is I'd see some right beating nystagmus. I can't really do that right now because I don't have that. My colleague next door is using it on another patient, so we're just gonna have to make do, okay?
That's fine.
Alrighty, so we just got done with that ocular motor exam, basically testing all those different movements of your eye.
Yep.
So based off that, we sort of think that it's multifactorial, like there's not just one thing that is causing your balance issues, okay?
Okay.
So what I'm gonna do now is I'm gonna run an outcome measure or a special test that tests a whole bunch of different aspects that help you with your balance. Okay? So it's going to test your somatosensory system, which is basically intact when you are standing on a firm surface. I'm going to include your vision, and I'm also going to talk about your vestibular system, which is what we talked about before.
Okay, sounds good.
So the first thing I'm going to have you do, I'm going to have you put on this beautiful gait belt because I want you to be able to be safe.
Okay.
I don't want you falling. So with this, I can guarantee you will not fall.
I don't plan on falling.
Alright, can you just lean forward for me? So the test that we're going to do is called the mini vest test. It's a whole bunch of different tests. It's going to tell me what you're having trouble with.
Okay.
And then that'll help guide my interventions to help treat you in the future.
Yeah, absolutely. That's great.
How does that feel for you?
Good.
Not too tight?
No. I'm really. No, I know.
Okay, that's fine.
Running around.
So here, you can. This is. I'm going to administer the mini vest to you. Okay. So what I'm first going to have you do is I'm going to see if you can cross your arms and stand up without your hands. If you can't do it, then we'll stand with your hands on your knees. But if you can't do it, that's fine. So try putting with your hands on your knees. Good.
Yeah, the arms
Okay.
crossed was just impossible.
All right, good. Now, so next what we're going to do is we're going to see if you can come up onto your toes and hold it for 3 seconds. 1, 2, 3. Perfect. So now what we're going to do, we're going to see if you can go up on one leg and hold it for 20 seconds, okay?
Okay.
You ready?
Mm-hmm. I haven't done this in a while.
All right, go ahead. Oh, okay. Let's try the other side.
No.
Oh, okay.
No.
So you're having trouble with that one. Okay. All right, now I'm going to try this one more time, okay?
Okay, yeah.
Each-
Give me another chance. I think I can do it.
Each side, okay?
Okay. Come on, legs.
Lift that one up and hold it. Oh, okay.
I can't.
All right, let's try the other side. Okay. No, that's fine. That's no problem. All right. So next what we're going to do here is we're going to see how well you do with your standing balance. So I'm going to put my hand on your chest, and I just want you to lean into me, okay?
Okay.
And then do whatever you have to do to maintain your balance, including if you have to take a step,
Okay.
So go ahead, lean into me. Now I'm going to just let it out. Good. That's great. Now I'm going to go from the side here. Out. Good. I'm going to go from behind, so lean back. Good.
I'm an old lady. I can't believe you would let me fall like that.
And then I'm going to have you lean to this side. Good. How are you feeling?
Fine. I just don't ever trust you with a trust fall.
That's fine. And remember on that scale that I showed you before?
Yes.
If you could mark this and this, where would you say on those 3 tests would you be at?
I don't really have that much, so probably like a 2. Maybe
Okay.
1 or 2. So a little bit, but not too much.
That's great. That's good.
Definitely not a 5.
Like I said before, we want to ensure that we're getting those symptoms.
Okay.
Okay? So stand on the ground here with just our eyes open, okay? We're going to see how long you can do that for. The goal is to get it for 30 seconds, okay?
I think I can do that.
All right, let's go. You're doing really well. We're a third of the way there. How you feeling so far? You look pretty
I
steady.
feel fine. Yeah, I feel fine.
Okay.
Started to say, look, because you started talking.
All right, 3, 2, 1, perfect. And you're feeling okay?
Yeah, absolutely.
All right, now we're going to come up here onto this blue foam thing, okay? So just watch your step here. All right, now what I want you to do is I want you to step up here. And I want you to close your eyes, okay?
Okay.
And we're going to see how long you can do this for, okay?
Okay.
And once you close your eyes is when I'm going to start the test. Ready? Go ahead. Whoa, okay, okay. So about less than 2 seconds, you'd say.
Yeah, that was a little scary.
That's fine.
I don't like not having the world underneath me.
Okay, so.
Or closing my eyes.
Okay, that's some good information. All right, now you can take a step off, and we're gonna put our feet onto this cube thing here, and we're gonna put our feet up, and then we're gonna close our eyes, okay? I know you don't like the closing of the eyes.
Okay, I trust you.
I'm gonna be holding you the whole time.
Just like this?
Yep, and then once you close your eyes, I'll start the timer.
No. Nope, not happening.
Can't do it?
No.
No, that's fine.
That is not happening. I feel like I'm gonna go backwards.
Okay, that's totally fine. So now what I'm gonna have you do here is I'm gonna have you walk. And then I'm gonna walk beside you. And when I say fast, you walk faster than normal, okay? And then when I tell you slow, I want you to go slower than normal.
Okay.
But I want you to maintain your balance. And if you can't, that's fine. I'll be here with you. Okay? So let's just walk at a normal pace. And then I'll say fast. And then slow. Good. How do you feel with that?
Just a little unbalanced.
Okay, so now what we're going to do here is I'm going to have you walk forward.
Mm-hmm.
And I want you to turn your head to the left when I say left, and to the right when I say right. Okay? So I'll walk right beside you, so go ahead. And I want left, and then right, and then left.
Oh my goodness.
Okay, good. So you're struggling a little bit with that one?
Yes.
Okay. So the
I
next.
can't usually do that when I'm trying to go in the grocery store. I kind of have to stop and look, and then I can keep on going, stop and look.
That's some good information. That's definitely going to guide my further intervention, okay?
Yeah.
So what we're going to do here is I'm going to ask you to walk normal pace, and then when I say stop, I want you to stop and turn as quickly as possible.
Okay.
And I want you to face the wall back here, okay?
Okay.
All right, go ahead. And stop. Good. How did that feel? So now what we're going to do is I'm going to ask you to walk and then step over the box if you can.
Okay.
So you just want to clear the box. You don't want to trip over it, okay?
Okay.
No,
No.
that's not for
No,
you?
no,
Okay,
no.
that's fine. That's fine.
I'm not doing that.
Okay, and then the last thing we're going to do, we're going to have you sit here in this chair.
Okay. Sit in the chair.
Okay. Nice and easy. Perfect. I'm just going to clear the path for you. So this is like called a timed up and go. Before I start, I'm just going to mark down all the things that I saw. So,
Okay.
good.
Gives me a chance to just recoup.
Yeah, that's great. Good, good. Okay. Okay, so with the timed up and go, what I'm going to have you do, when you're ready, I'm going to have you stand up, walk as quickly and safely as possible to this cone over here. I'm going to have you go around it, come down, and sit back down, okay? And I'm going to time you. So the timing starts when you leave the chair and when you sit in the chair, okay? And then whenever you're ready, okay? Good. You're doing a great job, Michaela.
Well, it's much easier when I have something to look at when I get to turn around.
Perfect. All right, so now what I want you to do is I'm going to have you count backwards by threes, okay? From 100. So this is a little bit harder. It adds a little bit of our brain into it, okay?
Okay.
So just count backwards by threes from 100
Okay.
while you're doing that same task, okay?
Backwards by threes.
Yes, I know. It's a little challenging.
From what number?
100.
Oh, goodness. Okay.
Okay, you ready? Set. Go ahead.
Like 97, 94, 90, 89, no, 91. No.
Hey, that was the same time, and you got like 4 out of 5 breaths, so I'll give that to you.
Oh, goodness.
And how are you feeling on that scale?
Well, I feel like I'm still about a 2. I didn't really have any
A 2?
of a change, yeah.
Okay. So some of the things that I really noticed that you struggled with was like the standing on the phone surface and closing your eyes was a big deal for you. And also like walking while turning your head, that seems to be a struggle. And also just like standing on the one leg and trying to clear obstacles. So those are all things that we can try to work on and get through together, okay? So while you sit here and take a break, I'm just gonna prepare my intervention for you. So I'm gonna grab just the phone for you so I can show you what I want you to do and stuff you can do at home as well.
Okay, awesome, sounds good.
Alrighty. So the first activity I'm gonna have you do, basically what we just did, what I want you to do is I want you to stand up here on the phone with your feet together, and I want you to close your eyes. And the goal is to get it 10 times for 10 seconds, okay? So I know you struggled pretty much right away with this, but if you do something more and more, you know, practice makes perfect, right?
Yeah, that is true.
And I'll be with you the whole time.
Okay.
Okay?
All right.
So we're going for 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and step forward. That's great. You're already showing improvement.
I'm going to do some licking.
That's fine. Yeah, and if you can't get the full 10 seconds, that's fine. That's just the goal for right now. So we can always work our way up to that, okay? So let's try that again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Okay, now you can have a seat. How do you feel after that one? A little challenging?
Definitely challenging, but I think it's a good challenge.
Okay, yeah, that's great. We want to challenge you just enough to try to get yourself used to it. It's a fancy word for, it's called habituation. It's basically just doing the same thing over and over again. It won't be as severe as symptoms.
Okay.
So a really good progression that we can do for next time is I can incorporate this foam wedge. And I'll just show you today, but we'll see this for next time. I'll have you stand up on here, like this. And then I'll be able to throw a ball to you, and then you can just maintain this balance. And the good thing about this is, I noticed in your chart that you're having some problem with some of your ankle mobility and range of motion. So this will help stretch those tight muscles.
Perfect.
So it's kind of like a 2-for-1 special. Killing 2 birds with 1 stone.
Amazing. That's exactly what I love. This is why I love PT.
And we would do that like 4 times for 30 seconds at a pop. But that's next time, okay? That's just a progression.
Okay.
So the next one we're going to do is, it's also just like one of those things that we did in that mini best test. It's going to be walking and then turning your head left to right and then going up and down.
Okay.
And this is something perfect for the grocery store. You know, you're looking for the Prego, and then you're looking for the applesauce.
How did you know
And then
that
the
I
Capri
use
Sun.
Prego?
And then the Capri Sun.
Yes.
All right, so
My kids love Capri Sun. Pasta, everything.
I'll walk with you,
Okay.
and we're just gonna stand up, and we're just gonna look. We're gonna walk forward, and we're gonna look left, and right, and left, and right. Good. Left and right. Good. And turn around. And now we're gonna walk. And we're gonna look up and down as we walk. Okay. So up and down. Up and down. Up and down. Up and down.
A little dizziness with that one.
A little dizziness,
Yeah.
okay. On that scale, what would you say you were at?
Probably about like a 3 or 4.
Okay, so that one's a little bit more than the horizontal motion.
Yeah,
But
looking
that's-
up and down, and I mean, even I think it might have just been from going to this and then this and then.
Okay, so like I said before, it's good that we incorporate those little bit of dizziness and stuff because it'll help you get better.
Yeah,
Okay?
I understand that.
So we're gonna try to do this 10 times, okay?
Okay.
So let's just go one more time for
Okay.
now. Good. Looking good, Michaela. All right, and turn around. And we're gonna go up and down now. Up and down. Up and down. Up and down. Good. Excellent job. You can have a seat. You feeling okay?
Yeah, I'm feeling okay.
So hopefully over time, you know, those symptoms won't be as severe. And yeah, and that's something that you can definitely help help you in the future, like I said, at the grocery store. So one thing that we can progress further with that is I can have you doing that side to side, and I can put obstacles in front of you too. So I know you said and I witnessed you struggle with the obstacles. So this is going to be a little bit harder. You'll be able to walk side to side. You see your peripheral vision, and you have to step up and over while looking side to
Well,
side.
that looks impossible.
What
So
if
if you
there's-
can get me to do that, I mean,
What if
maybe you
there's
will
a
be
spill?
the best physical therapist I know.
If there's a spill of juice on the floor while you're at the grocery store, and you want to step over that while you're still looking for all your groceries,
That
okay?
is just my worst nightmare.
And the same thing, you go up and down, and you step over. So this will be really good for, again, working with stretching, this motion, stretching these muscles back here. That'll get you better. And it'll also work with strengthening this one leg at a time,
Yeah.
because you're a little weak there. All right, so yeah, we want to do that like 10 times too, but that's, like I said, a progression, okay?
Okay.
So the goal of therapy, hopefully all this will help make you feel better, and we're going to want to see you like 2 times a week for like 6 times, okay?
Okay. Sounds
Just
good.
for 6 weeks, okay?
Yeah, that works for me.
Do you have any questions for me?
Not at the moment, but
All right.
yeah, I should do these at home too.
Yes, I'd say at home, make sure someone's around for sure. Let's
Okay.
make sure that someone's around and you're at a spot where you can hold on to, maybe like at the counter.
Yeah. Okay. Yeah,
So
the
the-
counter would work. I do. Yeah.
We don't want you falling, okay?
No, I don't want to fall.
And I'm going to take this back from you.
Okay.
Alrighty, thank you so much for your time. I'll see you
Thank
next
you.
week.
Yes, I'll see you next week.